Hi, I'm Tiffany, and I'll be talking about electronic health records, or EHRs. EHRs contain longitudinal collections of individual patients' health records. And what makes them a powerful tool is its integrated capability, which allows data about a patient to be accessible across different healthcare settings. Juan Yeno's paper, Application of EHR in Healthcare, details more about the system. So EHRs were designed with the intent of optimizing patient care by digitizing health records traditionally stored on paper files. Now, these EHRs aspire to establish an information network across different health providers, yet, as Zena mentions, these providers work in silos, often operating from not only different health-related software, but also with different vocabularies unique to their sectors. Not only that, Professor Young mentions other disadvantages that comes with the introduction of these EHRs, such as the cost of training, installation, and maintaining these systems, as well as its negative effect on clinician workflow. For example, with documentation burden in which physicians have to spend extra time documenting the patient visits. While EHRs have great potential, there is a lot of work to be done in improving the design and function of these systems.
The article describes six components of EHR. The first component of electronic health records is the administrative system. A main focus of this is patient identification. An example of this is that in Denmark, where I'm from, we have a CPR number, which is like a social security number, which is assigned at birth. It's then used as an identifier across all public systems throughout your life. The second is laboratory systems, which are rarely directly integrated into the EHRs, but can include data from laboratory machines or administrative systems. Third is radiology systems. This includes all medical imagery done as well as scheduling notes about the appointments. The fourth is the pharmacy system, which handles all prescription data. It is often re-entered into different systems if it's not integrated into the EHR. The fifth is computerized physician order entry, or CPOE, which makes physicians able to order appointments such as radiology examination. And the last is clinical documentation, which is basically a digitization of the doctor's notepad.
As the healthcare industry evolves, one key topic within electronic health records is privacy. As most supporters believe that electronic health records will improve care and reduce their costs, privacy of records are yet to be determined to remain held to their standards. Having successful partnerships for administrative health data standards can promote the development of clinical data standards and their application of computer-based patient record system. A barrier for adopting electronic health records is that people in need of access to the national system is nearly 12 million, which could eventually lead to breaches of privacy. Accountability of all parties that are involved with electronic transactions include patients, the physician's office, staff, and insurance companies are the key to successful advancement and electronic.
There are multiple factors involved in the trends of EHR development, with the primary concern being to retain a patient's privacy. The technological trends tend to be slower in the health tech industry than in most other industries. Despite the slower change, there are currently many developments regarding EHRs. First, with the use of extensible markup language, or XML, which is an encoded language which is readable both by computers and humans, and a resource development framework, a form of XML that isn't meant to be legible by humans, we can develop reliable structured data that is easily accessible. This will lead to better and more relevant data being used when necessary, and these developments are key in connecting the data we currently collect to a web-based service. Secondly, from a business perspective, the business that EHRs create from companies is only now being harnessed by these companies. We haven't reached the consolidation phase because we're still learning how to protect the data in a commercial setting. But furthermore, because there are so many structures in place right now, it's more likely that future change will occur in a larger, unified level. The end goal is to create an integrated system that benefits the patients to the largest degree. By creating an efficient system, patients can be helped regardless of where they go and what kind of help they are seeking.
In this article by Neil Vercel, it reports that computerized physician order entry systems are still making fatal errors relating to prescribing medications to patients. According to a data analysis from the Leapfrog Group's National Hospital Survey, CPOE systems failed to send alerts for 39% of potentially hard drug orders in 2015. Furthermore, they missed 13% of potentially fatal medication orders. In this modern era where people are receiving prescriptions left and right, doctors can sometimes not notice how harmful certain dosages or combinations of medications can be. Using a software that can catch these mistakes is more convenient. However, computers can only catch what programmers build into them. If hospitals don't update their inventory or build their databases to help algorithms identify potentially harmful symptoms as a result of medications, then the system will inevitably make mistakes. If there any other kind of system, these kind of bugs would only be a minor inconvenience, but because they're meant to save lives, risks need to be minimized as much as possible.